Hello, my name is Ivy. I'm a fourth year social work student at Toronto Metropolitan University. I'm currently completing my placement with the Organization for Safer Space. Today, I will be talking about racial trauma. In this video, we'll first look at what racial trauma is. We'll then look at some statistics, risk factors, symptoms, effects, treatment, and lastly, we'll look at some coping strategies. So what is racial trauma? Racial trauma, also known as race-based traumatic stress, is a physiological and psychological harm of racism, microaggressions, and racial events. It is an ongoing experience perpetuated by daily occurrences of racial bias, discrimination, and hate crimes, either experienced firsthand or as a witness. Racism is rooted in colonialism and white supremacy. Colonialism is imperialist global expansion of Europe and its control over colonies, which has resulted in adoptions of European politics, cultures, education, pedagogy, economics, among others. Colonialism has attempted to make white by favoring European behaviors, emotions, and ways of being, and recognizing only one race as acceptable. White supremacy refers to the policies and practices in society which exalt white people as patriotic national subjects, while devaluing racial others as threats to the security and prosperity of the nation. This results in negative attitudes and beliefs about racial groups that manifests as prejudice and stereotypes, as well as differential treatment through discrimination of groups on an individual level and through systems of racism. Statistics. In an American study, 69% of adults reported to have experienced discrimination at least once, while 61% reported experiencing discrimination at least every day. The pattern of these experiences was race. 34% of Indigenous Americans, 23% of Black Americans, 19% of Hispanic Americans, and 11% of Asian Americans reported experiencing discrimination almost every day or at least once a week. The level of their mental well-being further decreased for people who reported 2 or more experiences of discrimination. Risk factors and causes. Any racially or ethnically marginalized or stigmatized group can experience racial trauma. The primary risk factor for racial trauma is racial discrimination. Racial trauma can be triggered by stress or anxiety regarding racial factors or treatment, such as racial stereotypes. An example of this is when racial groups are considered worse at certain tasks. Fear about safety. This can include when a person of color fears police abuse. Witnessing people receive abuse, such as when a Black person sees videos of police brutality towards unarmed Black people. Racial abuse of loved ones, including parents, partners, or children. Direct exposure to racial abuse or discrimination, such as being called a racial slur by others, and experiencing inequalities due to race, including less access to health care. Symptoms. There are psychological, physical, and social symptoms of racial trauma. The psychological symptoms are similar to those of post-traumatic stress disorder, which include re-experiencing the distressing event by thinking about it continually, having flashbacks or nightmares, chronic stress, depression, anxiety, irritability, hypervigilance, difficulty concentrating, feelings of humiliation, and increased reactivity. These not only affect adults, they can also affect children as young as 12. Racial trauma can also affect physical health. The symptoms are exacerbated by the unequal access of healthcare for people of color due to systemic racism. The physical symptoms include physical pain, cardiovascular disease, hypertension, respiratory issues, digestive issues, increased risk of stroke, high blood pressure, and sleeping problems. The social symptoms of racial trauma include a reduction in school attendance or dropping out of school, and substance use. Effects. Racial trauma can affect almost every area of a person's life and leads to re-traumatization. Racial trauma can lead to a decreased life quality, reduced lifespan, lower self-esteem and self-worth, fear of the police after witnessing police brutality, dissociative problems, and avoidance of situations, places, or people that can trigger memories of the experience. Racial trauma can also contribute to mental health conditions such as post-traumatic stress disorder, chronic stress, depression, and anxiety. Treatment. People who experience racial trauma may have a good response to PTSD treatment, which can include trauma-informed psychotherapy, which helps a person identify emotions, process experiences, and use healthy coping mechanisms. Receiving support from people who have experienced racial trauma. Getting support from family, friends, and community members. Taking medication, including antidepressants, to manage depression or help with sleep, and lifestyle changes. Coping strategies. There are several methods to cope with racial trauma. Engaging in activism against racial discrimination to feel empowered. Joining a community that understands racial trauma and are willing to help one process their thoughts and emotions. Using self-care strategies such as eating healthy and exercising. Avoiding people who may not take the racial trauma seriously. Identify triggers and avoid them in times of distress, or make a list of ways to cope with each trigger. Role-playing how to respond to racial microaggressions. Engaging in prayer, and seeking professional help. If you have any of the symptoms described in this video, it is important to seek help. Feel free to check out the Organization for a Safer Space at forasaferspace.org, where you can have access to accessible, affordable, and affirming mental health care with licensed mental health professionals. Thank you for watching and have a great day.